Brilliant. Hello. So, yes, I'm Katherine, and this is Sara, and we've been conducting this randomised control trial, which we're here to present to you about today. So, thinking a little bit around the background that brought this research to life, really. So I guess there's a whole big host of research that shows that amongst the veterinarian profession, there's very high levels of distress and mental health difficulties, which is obviously why we're here today. But I guess coupled with that, particularly thinking about high levels of perfectionism and high levels of self-criticism. But kind of thinking from a psychology background and field, there's growing evidence that something called compassion-focused therapy is particularly good for individuals who are struggling with those high levels of self-criticism. Because I guess research has shown that individuals with high levels of self-criticism typically have lower outcomes in maybe sort of cognitive therapies or CBT interventions. So drawing this together, thought, okay, well maybe compassion-focused therapies would be something that could be helpful to address the needs of the veterinarian population. So that led me to conduct a feasibility study as part of my doctoral thesis, which really looked around whether an online compassion-focused intervention for vets was feasible, which it showed it was. It had really promising results and really kind of big appetite from the veterinarian community. So that then led me to apply for the Sarah Brown grant, which we were successful in, to then extend this research to actually conduct a bigger randomised control trial to actually look into the effectiveness and sort of in a more robust way. So as part of this, we recruited 162 veterinarians. You had to be, it was a veterinarian, either student or qualified surgeon, not already receiving a cognitive-based or compassion-based therapy intervention, and didn't participate in my previous study because it was using a very similar intervention. So we kind of really successfully recruited a whole range of individuals. We targeted individuals at the University of Surrey on their undergraduate programmes, which is where our research was based, but also spun out much more broadly, and it went quite big on social media. So actually, our sample was predominantly qualified veterinary surgeons rather than students, mainly female, in their mid-30s, and we very much met the minimum participants that we needed to kind of reach our power for the statistics. So, obviously, we recruited our vets, and what the intervention actually entailed was, say, each day for 2 weeks, so it was quite a short window, participants got access to watching a 10 to 15-minute video, which we'd made. And these initially taught skills or information around psychoeducation, so what exactly is self-compassion, how that fits with self-criticism, understanding a bit around the science around our own emotions, and then leading on to building some skills around sort of basic techniques of mindfulness and breathing, but then actually went on to some more compassion-based exercises around imagery, expressing compassion towards our own critical thoughts or receiving compassionate from maybe an ideal compassionate other. And so participants were either sort of allocated randomly to receive this intervention immediately or wait 10 weeks before they then got access to it. So you guys either got it immediately or after delay, but everyone did get it in the end. Over to Sara.
Hiya. So I'll talk us through the method and the results of the study. So in order to kind of measure the effectiveness of our intervention, we decided to use questionnaire packs that we administered at 4 different time points. So it was a pre-intervention, so immediately after being enrolled in the study, then immediately after the intervention, if you were in the intervention group, which was 2 weeks, so 2 weeks later, and then at a 1 month and then a 4-month follow-up. So that made it a 10-week study overall. And then thinking about the actual questionnaire measures that we chose, we decided to target some psychological outcomes that we know are particularly relevant to vet mental well-being based on the literature. And so we were looking at measuring self-criticism and self-reassurance, perfectionism, work-related rumination, so that kind of repetitive, negative kind of thinking that we can all get stuck in from time to time. Then fears of compassion and self-compassion. So those are the kind of 6 key outcomes we looked at. Now, looking at kind of the flow of participants through the study, just briefly, as Katherine mentioned, we recruited 162 vets initially, randomised them to either the intervention group, who received the intervention straight away, or the control group, who received it after a 10-week wait. And then participants really kindly completed our questionnaire packs at all of those time points we mentioned. I guess just looking at this, just briefly, one thing to mention is that you might notice that there was slightly more dropout in the intervention group than the control group. But we kind of had to think about that, and I think what that speaks to for us is that actually the control group had that incentive to keep going with their questionnaires because they received access to the course only after completing all of them, whereas the intervention group received it kind of straight away and so perhaps didn't quite have that same motivation to keep going. Either way, we looked at our kind of attrition rates, so the amount of participants who dropped out of the study, and what that showed is actually a really reasonable attrition rate. So between time points 1 and 4, we had about 35% attrition, which when I heard, I thought was quite high. But actually, research tells us that that's really reasonable for a study of this nature and for a low-cost intervention. So we were pleased to see that. And it kind of speaks to the fact that the intervention in the study was quite acceptable to the participants who took part. Just for comparison, I suppose, the previous study on which this study was kind of based had an attrition rate of about 51%. Now, I guess one thing to bear in mind is that they did launch just at the very beginning of the COVID pandemic, and so arguably there's quite a good reason for why that attrition rate would be higher. In any case, we were quite pleased with the attrition rate we did find. And so, what did we actually find? There we are. So we were really pleased and excited to see that people who received the intervention actually had significant improvements in a range of the outcomes that we measured. So namely, that was self-reassurance, resilience, self-compassion, and work-related rumination. So all of those things significantly improved for people who kind of engaged with the course for those 2 weeks compared to the control group. We didn't find that the intervention group had any significant changes to perfectionism, self-criticism, or fears of compassion, which was a bit of a shame. But we did kind of think about that a little bit more, and I guess one way of understanding that is that those kind of outcomes are considered quite stable. Perfectionism, for example, is widely considered to be a trait that kind of develops over the course of a lifetime, and so arguably a 2-week intervention might not really have scratched the surface on some of those outcomes, but in any case, we were really pleased to see that the intervention did lead to some really positive impacts for the vets who took part. And those changes were largely sustained at follow-up, which is really exciting. So it wasn't just immediately after the intervention that these benefits were received, but actually 1-2 months later, and in some cases, the benefits kind of increased over time. And so that's a really exciting finding. Those changes were also associated with small to medium effect sizes, and so what that tells us is that basically it's not just significant statistically, but actually the intervention seems kind of clinically useful for vets as well. And just to finish up then, I wanted to show you some slides quickly just to kind of illustrate some of these findings. So this graph here looks at resilience and changes in resilience scores over time. So you can see there's a blue line there at the top, which reflects the intervention group scores, and the green line below is the control group. And so what you can see here is there's that nice kind of upward trend in scores for the intervention group, which kind of shows that resilience scores were increasing over time for them, whereas they kind of weren't for the control group, and actually it looks like they started to drop a little bit. And then just quickly, self-reassurance showed a similar trend. So again, the intervention group scores were kind of increasing over time, whereas the control groups didn't. So that sort of, I hope, illustrates some of the effects of our intervention. Handing back over to Katherine now to sum up.
So brilliant. So kind of to draw this to a conclusion, really, we were very much excited. I guess this intervention has kind of shown significant improvements in increasing kind of well-being amongst veterinarians in a relatively short, fairly cost-effective intervention, limited obviously with a 2-month follow-up. That's not kind of being able to look at the really long-term picture, but actually had built on my feasibility study where I only looked at a 2-week follow-up, so kind of was able to expand on that, which was really promising. And I think this study has been particularly exciting because I think there's a whole, this huge literature showing the issues amongst the veterinarian population for mental health. But this was certainly, to our awareness anyway, the first study that's really looked at an intervention, a sort of so what can we do about this practically, and a bit more of a kind of a positive step forward, as opposed to maybe some of the literature can feel a bit bleak reading it sometimes. So yeah, we've really enjoyed this project, and yeah, we're currently being written up for publication at the moment, so it's very exciting. So thank you very much.
Thank you. Please join me in thanking our speakers. So any questions for Katherine and Sara in the middle?
Inundated with microphones. Great presentation, thanks. I was just wondering, did you ask any questions as to people's reasons for opting to participate, kind of thing? Was there any questions on that as to sort of why people chose sort of their predilections and things?
Yeah, no, we didn't ask anything like that. I guess as part of my feasibility research prior to that, we did ask qualitative questions, a bit more about what people had found they liked and didn't like about their study, or thoughts for improvement and things like that, which very much then informed our approach this time and tweaked the intervention a bit. But as to kind of what had motivated people to sign up exactly, we wouldn't know. But yeah, you can think, can't you, that probably the sort of people who are going to be signing up for a study like this are maybe slightly biased, and might have different motivations or insights already that are going to potentially kind of put them forward to be like, oh, I'd like to do that. So I guess that's always a limitation with these kind of psychology studies. You have that volunteer bias, don't you? But interesting question.
Thank you. I enjoyed that. I was interested about your retention of intervention effects, because that looks good, doesn't it? It's not only above baseline levels, but increasing slightly beyond immediately post-intervention. Can you say anything about whether there was anything you did during the intervention that might have specifically helped that, or anything afterwards? Were there any sort of drop-in sessions, top-up sessions beyond the intervention, or was it just a clean break?
I'm happy to take this one. So yeah, there wasn't really. It was quite literally a 2-week intervention. Participants were encouraged to watch the videos once a day. There was a new video every day for the 14 days. And our engagement stats showed that it was pretty good. Most people who were in that group did watch the videos every day. But after that was it. We didn't kind of monitor watching of the videos after that point, and we didn't kind of encourage it even. It was sort of just designed to be that 2-week period, and then we would examine the effects. But people did have access to the videos, so it's kind of possible that people who were quite enthusiastic, people who found it really helpful, might have actually been watching them more. And so I guess it's possible that perhaps they did continue, but it's not something we measured or kind of, I guess, asked them to do. So I think a few people who got in touch with me did respond really well to the videos and said that they found them really helpful, and kind of were hoping to download them and get them on their phones and things to watch at work. And so it's possible that, I guess, there was a bit more watching of it than otherwise planned. But that being said, I guess it speaks to perhaps that actually it had some quite lasting effects on some of these measures, which is really exciting to see in such a small intervention.